Hey, everybody. Welcome to the HomeHappy Podcast. I'm Mike with our usual crew, and I'll do some introductions. Kalinka, you're here. Dallas, you're here. Say hi.
Hello.
Hello.
And we have some special guests. We have Dr. Rachelle Peltier. Did I say that right?
Rachelle. Yeah.
Rachelle. I'm so sorry. Oh, I knew I'd screw that up.
French Rachel.
And Dr. Mike Henry. And they are both naturopaths, and we just thought it would be a really interesting discussion to find out more about what they do and how they help people. And let's take it from there. Maybe you guys can introduce yourselves and say your name properly. That'd be great.
Go for it. Yeah, thanks so much for having us here. My name is Dr. Rachelle Peltier. You can just call me Rachelle. I've been a naturopathic doctor in Kelowna now for 2.5 years.
Cool.
Wow.
Yep. And Mike?
Dr. Mike Henry, same thing, naturopathic doctor, practicing in Kelowna here since end of 2022. So 2.5 years now. And we moved here fall of 2022, got our practices set up, and now we've got 2 separate practices each going on. And we have a little bit of a different focus in our approach. But Rachelle, do you want to start with kind of your style of practice?
Yeah, I mean, my whole focus area is women's health. So kind of everything that falls under that umbrella. My main area practice is a lot of, like women's hormonal health, perimenopause, menopause. It seems to be a hot topic nowadays with like everyone wants their hormones balanced. So we talk a lot about that in my practice. And then a fairly large piece of that as well is fertility. So fairly strong background in fertility care. So helping a lot of couples start their families. If you have kids, it's usually a lot harder than people expect. And so I really love that part too, getting to help couples, grow their families and have kiddos. So that's pretty special too.
Oh, that's such a nice passion. I love it.
Yeah.
So I definitely do not do fertility. Fertility cases to Rachelle. My practice is primarily focused in chronic injuries, sports management, pain management, things like musculoskeletal injuries. So I do a lot of regenerative injection therapies. And the rest of my practice is kind of divided between male hormone optimization, doing some cardiovascular prevention, and a lot of gut health as well. So there's quite a broad spread, but that's sort of the territory of where our profession draws. We have a very preventative focus. Really, the idea with naturopathic medicine is trying to identify what is the root reason why you're having the concerns that you're having and deal with that rather than only treating based off of symptoms. Yeah.
Cool. I love it.
And I fall into every category that Mike deals with.
Oh, wow. I find that fascinating. It's so nice to really go back to the cause of it all. Mike, can I ask a quick question here?
Absolutely.
What do you guys think is the biggest misconception that people look at in the naturopathic medicine that you guys see?
I would say, there's a lot of misconceptions, and
Totally.
part of it with the fact that our scope, what we can actually do as practitioners in BC, especially, is very, very broad.
Mm-hmm.
So you can have 20 different ways to practice, and with that, you're going to get some more maybe traditional Eastern approaches, more acupuncture based, Chinese medicine based, and then you get more of a Western approach with other practitioners. I think the biggest misconception is that we're not evidence-based practitioners, right? So say, the treatment you're recommending isn't a prescription, it's not a pharmaceutical, therefore it's not evidence-based. And there's actually there's a lot of flaws inherent in that, and there's definitely different levels of quality of evidence, but there is always a reason and a supporting piece of evidence for whatever it is that we're going to be using. It just might not be standard criteria that is getting the approval for certain medications.
Wow, very interesting.
Yeah, there's a lot of funding for things that you can't patent. So the whole lack of evidence conversation is a little bit nuanced as well, because when we're talking about using vitamins, minerals, exercise, nutrition, and even certain herbs, it's like, well, you can't patent vitamin D, you can't patent an exercise program. There's no real funding because there's no real profit to be made. So it's part of the conversation too.
Yeah,
and
that's probably one.
Sorry.
It's got to be one of the biggest growing industries, like especially with the amount of podcasts going on, Gary Brecken, everything else, and everyone jumping on the bandwagon.
Yeah.
Well, not the bandwagon. It's actually the wagon. Like,
Yeah.
The
I
wagon.
don't know, when I go to my doctor, I'm going to just get prescribed something. And unless I need surgery, I think that's the only reason why I need a hospital.
Yeah.
Yeah, and I think having like one of the benefits we have is that we have a lot more time with patients. So our visits are usually anywhere from 30 minutes to an hour. And so we're not jumping from one question onto the next patient.
Mhm.
And that gives us the chance to actually explain why we're recommending the things we're doing, because oftentimes the patients are coming in very, very informed. Like the next generations are much more up to date on what it is that they're doing, why they're doing it. They're coming in, they're going, I listened to this podcast, I listened to Huberman Lab, and they recommended I do these things for supporting my brain function. You know, what do you think? So if we're not up to date on that stuff, it's very obvious. They catch on quick. And I have a lot of
Wow.
patients that inherently will be more educated on their particular condition than a lot of the people they've worked with in the past. And so they
So
see
interesting.
right through a lot of the recommendations if you're not kind of keeping up with it.
Mm-hmm.
Wow, that's I think there's so much there. I mean, I think a lot of the classic doctor situation these days is I don't know. There's a lot of pharmaceutical pushing, and I don't want to get too far into that, but we all understand that's kind of where we are with those, and you get 10 minutes to kind of get your prescription and out you go kind of thing. And I love that you guys deal with it from the like, what's the issue and how can we solve it, not just let's give a pill for fixing that, like, because it doesn't really fix it. So and I know that's very generalized, but it is fascinating to me. So do you find like a lot of your clients are younger generations, or is it mixed, or how do you find that?
I think it probably depends on like what you're treating and what your demographic is. I would say for me, it's predominantly women between 25 to 65. So that's pretty broad. But I do think that it's probably more, people in their 40s and 50s who we see the most of. And I don't know if that's necessarily because of like the trend and what's happening in health and people drawn to us. I think a large part of it is access to care in terms of insurance, because when you're seeing private practitioners, it's not cheap, it's not free like our public healthcare system. So a lot of people who come to see us are the people who have benefit coverage for naturopathic medicine. So I think that probably dictates a little bit of who we see. I'm sure if everyone could access it, then it would look a little bit more broad, but at least for me, it's predominantly people in that kind of like already have some sense of a career established and have a benefit plan that will help facilitate their access to us.
Right.
I think when it comes down to me seeing these guys is, okay, we've, you kind of have all the toys, and now it's time to start looking after your body a little bit as it starts to break down. So your body becomes your main goal.
Yeah.
Yeah. No, that's fair. Do you find I lost what I was going to say. Sorry, Dallas, you threw me off. Sorry. You go, Clint. Go ahead.
Yeah, no. Going back to what you were saying earlier, I think people are looking a lot for like a band-aid, a quick fix, right? And I think educating them on the root cause of what's really causing it, and for them to understand that it's a long-term goal. At the end of the day, it's not a quick, Advil pill to fix your headache, but it's more looking at the whole picture of it. And I really, really love that. So.
Yeah, it's definitely interesting when patients come in. Sometimes they say like, "Oh, I really believe in what you do. Like, thank you." And I was like, "What do you mean you believe?" Like,
yeah,
yeah. I mean, I try to like not doing something crazy outside of the box, but I think a lot of patients come in with the misconception that we're so anti-medicine, we're anti-pharmaceutical, we're like, very against the whole conventional system. And it's never that way, at least not for me personally. And I can speak for Mike and say not either. It's very much like a overall team approach, never an us against them. It's like, let's work with your providers to, kind of come at this from multiple angles, because it doesn't help to say like, well, everything you've ever heard is wrong from your GP and like, ignore them. It's like, no, like you need them. They are part of our, like the healthcare team. They just have a different toolkit than we do.
Yeah.
That's awesome.
And I would think you can expand because you've got more time to learn more about the client and that kind of stuff. And so, I mean, I got to think you guys are always probably educating yourselves on things like that. I'm betting that's part of your life. You just keep going and learning more.
It's not really an option.
Yeah.
We fall too far behind. If you're out of commission for a year, the patients come in and they know more than you.
Wow. Yeah. I think, how do you get people to, I mean, obviously when people have a situation, they want to deal with it, but how do you reach out to people that, maybe they don't have a exact issue right now, but they're not necessarily looking after themselves all that well either. So, is there a way to kind of approach that? I don't know. Is that something you guys do?
Yeah, I think a big part of it is coming at it from a health prevention standpoint and recognizing the time and financial cost of not making a change now, right? So typically if you're getting your regular annual check-in and hopefully you're getting regular annual blood work, you're going to get some baseline markers, whether it be your blood sugar, your cholesterol, any of these other markers. And where we come into play is we get a very broad reference range for a certain value. And if you're anywhere in that range, it's deemed normal and nothing is done or nothing's recommended. But there is a fine-tuned zone within a broader range that can get you a higher chance of avoiding disease in the future. So just because your lab marker isn't flagged, it doesn't mean there isn't room for improvement, because we have the data to show, look, if you're in the higher end of this category that's still deemed normal, your risk 10 years from now could be higher.
Sure.
And if you've got a family history of dementia, if you've got a family history of heart disease, diabetes, any of these things, then we have to take that into account. And if you make an effort to change now, the amount of effort you need to make is much easier than if you wait 5 or 10 years down the line. And then you get the diagnosis and then they go, well, here's the medication, it's irreversible. It's like, well, it would have been reversible before.
Right. Yeah, no, that's really cool. Do you find, I mean, I'm the oldest one here, I'm sure, but when I was 20, I thought I was invincible and didn't need to see a doctor for anything until something happens. And is that still kind of the way it is, or are people getting different now? Or
I'll let you answer this in a sec, but I think it's changing quite dramatically. I think the next generations, the podcast generation, the internet generation is very much more on top of how they're eating, what they're doing for their bodies. Now, we're definitely in a bit of a silo. Like the type of patients who are going to come to see us are in general health focused. So I already have blinders on to a certain part of the population that maybe isn't as aware, but I would say, yes, I do think the next generations are more focused on their health.
Yeah, I would agree with that as well. And especially the context where, I mean, I can't speak from experience, but from my understanding, maybe the generations a little bit older than us had a lot of trust in their physicians, where it was like, I'm just going to go and live my life in the way that I want to. And if something goes wrong, I go to them and they fix me. They give me the thing to make me better, to keep, and I don't have to think about it. Where I think the overarching theme is very trending more in the proactive direction rather than the reactive direction in terms of healthcare. Which I think is great. And I think this is where people are maybe getting fed up with more of the conventional system, because it's people call it like the sick care system. It's not healthcare. It's like once you're sick, you go in and then they can or may not direct you, but they're not focusing on health. They're focusing on, digging you out of the hole that you're already in. We're trying to encourage people to put down the shovel.
Yeah. And I would think that's a little bit to do with, let's face it, I mean, somebody, in the 40s, 50s, 60s, your lifespan wasn't as long. I mean, we've changed that a lot in very short generations. So, yeah, I mean, I think I would agree with you. I mean, you guys know better than I do, but I would think that younger generations, through information, but also just the fact they probably know they're going to live to be at least 80 or maybe more. And so but that's not going to happen if they just shut their eyes and wait. Right.
There's definitely a conversation to be had around like health span versus lifespan as well. So if you've heard of those terms before, like, yes, people are, we can prolong life into, 80s, 90s, 100s, but like, what is the quality of life of those years lived? And we talk to patients about this all the time in regards to like, okay, your 50s and 60s, if you make these changes now, then like you could have a very healthy, robust 70s and 80s and like comfortable, longer life. And unfortunately what we see happen is people work their butts off, until they're 50, 60 years old, and they finally retire, but they're so sick they can't enjoy their retirement. So I think people are waking up to that fact and trying to, either like reverse the issues that are already present, or hopefully, starting a little bit earlier in their 30s and 40s and trying to change the narrative.
That's great.
Yeah.
I guess, do you guys have a question? Anything you're going to add? Alice?
No, that's pretty good. Like I was just thinking, I have my aunt and uncle, and he went to his doctor, and you get checked out. My aunt would be like, "Listen, what you're eating is terrible."
Yeah.
And his doctor said to him, I remember him telling me this. He said, whatever you're doing, just keep it up. And then now he's got type 2 diabetes.
Yeah.
So it's just kind of a perfect example.
Mhm.
Yeah. Okay, you know what? I think we're going to leave it there, and we'll do a part 2 for this, because this has been great. Thank you so much for doing this little introduction to naturopath for us. I think we'll stay there, and like I said, we'll do a follow up to this. But thanks so much for being on here. Really appreciate it.
Absolutely.
Easy.
Yeah.
No
Thanks for having
problem.
us.
Thanks so much.